Dear students, my colleagues, and all the respected dignitaries sitting on the dais. I, Dr. Anita Agarwal, Associate Professor in Department of Physiology, is grateful to have got this opportunity to introduce to our baby GS sites our respected Dean, Dr. Sangeeta Rawat Madam. Madam is a GS site in true sense. She did her undergraduation, post-graduation in general medicine, and DM in neurology from this very institute, that is St. GS Medical College and KM Hospital. Madam is heading Department of Neurology from 2002 onwards. She is a clinician par excellence, keen researcher, and a focused academician. She is a member and joint secretary of Indian Epilepsy Association. Madam has contributed chapters in various textbooks on epilepsy and congenital malformation in brain. She has over 60 publications in various national and international journals. We are lucky to have Madam as our dean. She is all for our GS students. She has started Student Dosti program last year for our students to solve various difficulties faced by the students. Madam is pioneer in starting refurbished MICU and stroke unit at St. GS Medical College and KM Hospital in 2022. With this short introduction, I request Madam to address our newly admitted students. Madam, please.
Good afternoon to all, and a warm welcome to this prestigious medical school, St. GS Medical College and KM Hospital, which is known for its academic excellence, its high ethical and moral values. You are the new cohort of students who are beginning to a remarkable journey. And this is your first step towards becoming a doctor. It is going to be a challenging, but in the end, you are going to be transformed into a healthcare leaders of tomorrow. Entering the field of medicine is not just a career choice. It's not like you've just taken an engineering or just taken a bioethics, things like that. It's a commitment and calling for a higher purpose. As you embark this incredible journey, there are few guiding principles which I would like to tell as a dean and as an alumni of this hospital. My association of this hospital is right from childhood when I used to come with my father as a child to see the cultural programs or sometimes accompany him on the rounds because my father was a pediatrician here and served this institute for 25 years. So it was my dream from right from childhood to come here and join here and find. I never dreamt that I'll become a dean, but definitely to continue working in a government hospital because I'd seen the patients suffering over here. So the few things which I want to say that, now when you're going to become a doctor, you will have a privilege and responsibility that comes with this medical profession. You will have a power to heal. You will have a power to alleviate the suffering of patients. And you will make a meaningful difference in lives of hundreds of people. Nobody has this privilege unless the doctors. So it is important that you realize this responsibility and you cherish this privilege with sympathy, dedication, sincerity, hard work, and empathy. So this is something which you have got, which you have to utilize to the fullest of your ability. Secondly, medicine is ever evolving field. There are always new research, new management guidelines, new treatment, new drugs. So though you complete your MBBS or you complete your medical post-graduation, never stop being a student. You will not be a good doctor unless you are up to date with your knowledge. Only when you are up to date with your knowledge, you will be able to guide your patients to the best treatment options available. I completed my DM. My career was like I've become a DM neurologist, but still I went further to specialize into epilepsy. After I specialized into epilepsy, I came back, started Comprehensive Epilepsy Care Center here, which is one of the fourth in India in the rank. We have done so many epilepsy surgeries. After that, I thought I should do something more. We started a stroke clinic. We started a memory clinic. This was just last 2 years back, the memory clinic. So always keep thinking that you should do something new and be a good teacher is always a student lifelong. So never stop being student. Till today also, I read the journals, I read the new articles because only then you can do justice to your patients, justice to your knowledge, and justice to your profession. Thirdly, I want to say that when you enter this medical college, it's not your one person who is treating the patients. It's going to be a collaboration with your other disciplines. In the ward, collaboration with nurses, collaboration with class 4 servants, technicians, and the whole team which is taking care of the patient. So always respect the guidance, the knowledge, and the wisdom which they have gained over the years. You are new to the patients, but they have gained this over so many years. So never disrespect the nurses' advice or the class 4 advice also. They will tell you if you are trying and doing a lumbar puncture, they will say, this is the best position, doctor, only then you will be able to get. So listen to them. I still remember my husband became a DM cardiologist and he joined in Australia in a new hospital. The first day he had a patient of atrial fibrillation. So he said, yes, I know the treatment. He went and he wrote the treatment. The nurse over there came and said, doctor, this is the protocol. This is not what we follow. And he had to agree to that. Definitely that protocol had something more additional than what he had written. So always respect the wisdom which others in your department, in your institute has, because they have gained this over so many years. And if you respect them and listen to them, definitely you will be able to have a whole team working together for the betterment of the patient and the outcomes will be best. And always acknowledge them. Whatever they have said, acknowledge their help and always acknowledge and to the patient also. Today, you have given them on the written prescription. But who is going to administer? Nurse is going to give the injection. Nurse is going to give this. If he requires a diaper, who is going to give? The class 4 is going to give. Who's a physiotherapist will give the exercise. So it's a whole team effort. So never think that I agreed that you are the one who is director, the most important person, but there is a whole team. So always learn to act and learn to team together. So together, everyone achieves more. That's the principle you should remember as a doctor. It's not one person who's going to do everything. Definitely, if your knowledge is best, you will come to a best diagnosis. But respect that your teachers. Now, coming to my faculties here, the faculties at KEM are one of the best scholars which you have. They have done empty number of researches. They have done with their excellent knowledge. They are far excellent in their career, and then they have come to this college. So respect them. Get to try to know them. So it's not that you have taken a talk, you have finished the lecture, you just walk out. Try and meet them. You have to know your teacher to get best of them. Try to meet them or talk to them after the lecture. Try and see what research they have done, what they are planning to do, what was their interest in career, and after that, when you develop a rapport, go and tell your ideas of research. And that's where you will be able to generate a rapport between your teacher and your student, and definitely you will come up with more research projects and more research articles if you do that. So you have to follow and pursue your teachers to get the best out of them. They will come, they will, and I'm sure not a single teacher will say no if you want to go and meet them after the class and you want to talk to them. That's the culture we as a GSITs have. Always the students are first. And I'm sure all of my faculty will never say no for this. And to that extent, even dean's doors are always open. As they said, I also felt that student dosti program. Why have I started that? Because I wanted that students should have a mentors who will guide them. It's not only for your, there is also a part of, one wing is that the mental health, we have a psychologist who will help you any time of the day, but we also have a mentorship to teach you how to do a research, how to do a presentation, even a simple seminar in your third MBBS, if you do, how to prepare the slides. Everything has to be taught and your mentors will definitely help you in this. Additionally, then you will have to also develop a resilience. Whenever in this journey, a long, long journey, it is going to be years and years together. You will have places where you will have a medical triumph, patient will become well and patient will thank you, give a bouquet and go home. But at times you will have a patient's relatives scolding at you, patients themselves not happy being you. Your seniors are telling you this is the mistake which you have done. Definitely. So you have to develop a resilience, and that's where your strength of your character will come up. Always make sure that your conscience never bites you at night. So if you are, definitely mistakes can happen because you are on a learning curve. Mistake can happen by me also, by madam also. Anybody can do the mistake, but accept your mistake with humility and never go back on saying sorry. Always use this word more often. It gives pleasure to the opposite person. It may lower your ego, but don't be so egoistic in medicine. If you have done something wrong, accept it. Go and tell your seniors, go and tell your colleagues, just go and tell your nurse also, मेरे से भूल हो गई, गलती हो गई. Next time I'll keep in remember. So you just see how much difference it will make in your rapport with that person. So remember that develop a rapport with everyone around. It may be your fellow colleagues or it may be your others. Thirdly, I also want to say that when you are going to go through this long journey, you never don't neglect yourself. It is important that you feed yourself well, you take self-care, because if you are not going to be more good, how are you going to heal the other patients? So strike the work-life balance always. Try and take out, you want to read all night, but instead of that all night, try and do a regular study from day one so that you don't have late nights. If you have late nights, definitely there are going to be effects on your health, in your memory and everything. So try and be regular in studies right from day one. You have achieved all this after 12th of hard work. You come to the best college, and I'm sure your parents are also very proud about it. The parents who, I want to tell them that your heartiest congratulations to your parents that they have cultivated you into future doctors. But I want to tell them one more thing, don't leave them over here. Keep persuading them, keep talking to them. Also keep coming physically when they're staying in the hostel. Keep meeting them, keep meeting their friends. Whenever you come here, take a group of them out for a dinner. I used to do that when my son was in Nasik doing his MD medicine. We used to go for a weekend and take the whole bunch out for a dinner. It gives a lot of pleasure. At the same time, you come to know what your child is going through. Does he have any problem? The child may not be able to share that, but if you meet his or her friends, definitely you'll know if there is a problem, if they need any help. So as parents, don't leave them that they have become adult, they have become mature, they will take care of them. Always mother's and father's help is always required at any age you live. Today also till before going to sleep, I make a phone call to my mom. She's 91-year-old, but I still make a phone call. So I want to tell you as a students, every night you may be doing WhatsApp, some Instagram reels, this, that, but before going to sleep, one phone call you make to your parents saying that, yes, I'm well, mom, I'm fine. Just say one or two incidences of your day. That will make them a peaceful sleep at night. That will tell them that you are good, you are doing well. So if you just follow this as a routine habit, definitely your mental health problems will go down drastically because you have someone in whom you can confide. And let me tell you, after this age, your father or mother are the best friends. So don't give up once you come here, don't lose contact with them. Continue talking to them every day. 2 minutes of phone call will keep you and your parents' relationship very healthy and it will help you in developing a better doctor. Let me tell you this, I'm talking from experience. Okay. Today, my son has gone to Australia. Every day I have a video call. Why? He doesn't need me or I don't need him. It's not like that. But that tells us a peaceful night sleep. He feels, okay, my parents are fine. So do that also because all I'm sure many of you are from far away from Bombay. Your parents are not here. And I'm sorry, we are not able to give you good hostel also. I'm trying, our new building is coming up very near future. Within a year, we'll have the new hostel of 1,200 students. But wherever you are staying, always just try and keep in touch with your parents. So I think this, in the end, I want to say that when you have come to this road ahead is going to be incredibly difficult, but also very, very rewarding because you are going to become someone who can heal the patients, someone who can alleviate their, Vivekananda's one thing which I always tell is Sau Jiva Shiva, and that was going to be the motto, and that has remained a motto of my life always. So you also can have that motto always. Each of you have a potential to make a profound impact on the lives of the countless individuals, and together you, and I'm sure you all are going to make us proud in future. You are going to be the health volunteers or health of tomorrow who are going to take care of our health when we fall sick. You are going to look after us. So definitely we are interested in making you the best doctors, and that is what the 5 years of being here will make you, that I can assure you for sure, as a dean of this prestigious college, that you will come out as the best doctors. And in the end, I welcome all of you, congratulate all of you for getting into this this Seth GS Medical College in KEM Hospital, which has one of the Asia's best medical college. There are shortcomings which we do have. We do not have a classroom up to 50 students. We are in the process of making that. But knowledge is there. The teachers are there. So do not bunk. Attend regularly. You will definitely get a lot to learn from your teachers because they have the wisdom of book. They have the wisdom of practical knowledge, which you may not be able to get only from books. So it is important that only books studying and doing only neat questions is not going to be that you will become a good doctor unless you go and read with the patients, listen to the lectures which are given here, the practicality which they will teach you, only then you will become a good student and good medical student and a good doctor who will be touching the human lives, and you will have that privilege all your life long. So with that, congratulations once again, and I wish you all the best for a successful and fulfilling medical education, and congratulations and best wishes to all the parents also. Thank you.
Thank you, madam. It was a very good your talk to the students, and I think students will really like because all department has given introduction, and this was a nice thing. We couldn't arrange it on the first day. There were a lot of problems. So thanks, and then the team will take up for the your computer skills and all. Thank you, students.